Hello, my name is Casey Kegelmeyer, and I am the Care Coordinator here at Community Care Center. I want to first thank you all for being here today. Before we begin, I would like to give you a little insight into my background as a nurse. I have been in nursing for 9 years. I became a nurse in 2016 when I graduated as a licensed practical nurse. In my 7 years as an LPN, I worked in doctor's offices, including primary care and urology. In 2022, I received my Associate of Applied Science degree from Kent State University. When I began my career as a registered nurse, I worked on a medical surgical floor at a local hospital. When I was given the opportunity to work as the care coordinator for the community care center, I was nervous, as I have never worked within a long-term care facility. Luckily, we have a wonderful team here at the Community Care Center who have guided me through my initial rough patches. I now cannot see myself doing anything else. To be a part of the coordination of care for our residents is something I take great pride in. Thank you and welcome to Community Care Center. Let's get started. I appreciate you joining us today. I have prepared a presentation for you regarding the care coordination and how it relates to government and state policies as well as to your organization. We will be discussing continuity of care as well as ethical principles and how the Nursing Code of Ethics affects patient care coordination. We will start our presentation by discussing coordination of care. What is care coordination? Care coordination is defined by Albertson and colleagues as the intentional organization of patient care across multiple participants, accompanied by the sharing of relevant information to improve the safety and effectiveness of services. As a registered nurse care coordinator, I oversee the coordination of a patient's care from start to finish. However, care coordination requires help from all members of the healthcare interdisciplinary team. Members of a healthcare interdisciplinary team include the patient's primary care physician, nurses, specialist physicians, social workers, pharmacists. What do registered nurses do when employed as care coordinators? The American Nurses Association provides a list of registered nurse care coordinator duties on their website, www.nursingworld.com. In their article titled The Essential Role of Registered Nurses in Care Coordination, a list of essential duties of nurse care coordination includes developing patient care plans, educating patients and their families, monitoring patient progress, maintaining patient safety while providing quality care, and assisting the patient during times of transition from one provider or facility to another. Care coordinators create a safe, smooth transition of care for their patients. What factors are associated when determining if care coordination has been effective? Appropriate care coordination leads to improved care quality and clinical outcomes, improved communication among staff members, safer transitions for vulnerable patients, an overall reduction of costs for the organizations involved, and a reduction in the rate of readmission. Next, we're going to discuss government policies and how they affect the coordination of care. We will be discussing the Health Insurance Portability and Accountability Act, or HIPAA, the Affordable Care Act, and the Nursing Home Reform Act. We will first discuss one of the most well-known government healthcare policies, HIPAA, the Health Insurance Portability and Accountability Act. HIPAA is a government policy that came into effect in 1996. HIPAA is a federal regulation that protects patients' health information from being shared without his or her consent. HIPAA is regulated by the United States Department of Health and Human Services. HIPAA addresses the way protected health information is used and disclosed. Any disclosure of protected health information must be approved by the patient, with the exception of law enforcement, law and judicial proceedings, workers' compensation, instances of domestic violence, abuse, neglect, or during instances that protect the patient from serious harm or death. Violating HIPAA is a serious offense that may bring forth large fines and even imprisonment. Civil violations range from $100 to $1.5 million in fines. Intentional criminal violations may bring penalties of up to $250,000 and 5 years term of imprisonment. That's according to the American Medical Association. While HIPAA is a wonderful law that protects individuals from disclosure of their protected health information without their permission, it can also hinder the coordination of care. HIPAA's regulatory framework has the ability to hinder coordination between healthcare entities. This causes the inability to share the protected health information between different parts of the interdisciplinary team. The Affordable Care Act. The Affordable Care Act was established in 2010. It is a comprehensive healthcare reform with 3 main goals. Goal 1 is to make health insurance more affordable to consumers living under the federal poverty level. Goal 2 is to make Medicaid accessible to all adults living below the federal poverty level. The third goal is to support more innovative medical care to lower all medical costs overall. The Affordable Care Act supports the coordination of care. Under the ACA, hospitals are required to employ nurse care coordinators to ensure patients receive necessary follow-up care, thus improving hospital reimbursements. Given the facility in which I work, I would like to discuss with you the Nursing Home Reform Act. The NHRA was enacted in 1987 by President Ronald Reagan. The NHRA sets standards for the care of individuals living in long-term care facilities, like the Community Care Center. Under the NHRA, long-term care facilities that wish to receive Medicare and Medicaid funding are required to implement services and standards to residents that promote the highest practicable physical, mental, and psychosocial well-being. One of the largest provisions of the NHRA is the emphasis of patient quality of life and patient care. Another provision of the NHRA is the mandated restriction placed on the use of restraints for nursing home residents. These restrictions lead to reduction in nursing home abuse rates and increase in patient dignity. Care coordination within long-term care facilities, such as the Community Care Center, goes hand in hand with the foundation of Nursing Home Reform Act. Residents must receive the highest quality care possible for care coordination to be successful. It is my job to act as a liaison between our residents and the rest of their healthcare team. Essential functions of my job are to develop individual care plans, educate residents, and inform their families and educate them, supporting the concerns of my residents about their care and maintaining open lines of communication with all the other healthcare providers. As a member of the American Nurses Association, you and your team are affected by these government policies just as I am. When new federal laws are passed, the American Nurses Association holds a special place in the development of new healthcare policy. The ANA has a Policy and Government Affairs Department that advocates for policy and law to be enacted that benefit the well-being of both nurses and the patients. Provisions of federal law affect how we can deliver the coordination of care for our residents. Long-term care nursing facilities like the Community Care Center have a long history of staffing shortages. Years ago, the world was ravaged by the COVID-19 pandemic. Staffing issues during the pandemic have led to the Centers for Medicare and Medicaid Services to hold nursing facilities responsible excuse me, for providing safe, effective care to their residents. This rule centered around staffing ratios of nurses to residents. This new rule fosters a safe, more effective care environment for nursing home residents. According to CMS, the requirements they wish to enact are as follows. A requirement of 3.58 hours per resident day of direct care for each resident. 0.55 of those hours must be direct care by a registered nurse. Another 0.48 hours per patient resident day must be provided by either an RN or LPN. And 2.45 hours per resident day must be given by a nursing aide. This rule by CMS will greatly impact patient care and lead to better coordination of care. Another topic that is important to the American Nurses Association and to our team here at Community Care Center is the Nursing Code of Ethics. What are ethics? The word ethics stems from the Greek word ethos, meaning character. The Nursing Code of Ethics was developed in the 1950s by the American Nurses Association. The Nursing Code of Ethics guides nurses in setting goals and making value-based decisions in their practice. The Code of Ethics is a set of ethical guidelines that all who enter the nursing profession are expected to abide by. The Nursing Code of Ethics consists of 9 key provisions to guide practicing nurses. Provision 1. Nurses must practice with compassion, respect, and ensure dignity is upheld for each patient and family member. 2. The nurse's primary commitment is to the patient. This pertains to all patients, whether an individual, group, or community population. 3. The nurse advocates for patient rights, health, and safety. Provision 4. Gives the nurse the authority to make decisions and responsibility to provide optimal care to patients. 5. The nurse owes themselves the same duties they provide to others, including health promotion, maintaining competence, safety, and continued personal and professional growth. Provision 6. The nurse establishes and maintains ethical work environments to provide quality care in a safe setting. 7. The nurse advances the profession through research, scholarly inquiry, and professional standards of development. 8. The nurse collaborates with other health professionals to protect patient rights, promote health diplomacy, and reduce any health disparities. And 9. Nurses, as part of the profession, must maintain integrity, integrate principles of social justice, and put nursing values into action. The American Nurses Association lists 4 main principles of nursing ethics. The first is autonomy. Autonomy is when nurses and healthcare team members provide patients with necessary information to allow patients to be part of making their own healthcare decisions. Beneficence is the second principle, which ensures that a patient's best interests are taken into consideration when providing care. This means the nurse should not allow their own opinions to cloud how they provide their patient care. The third ethical principle is justice. Justice in nursing ethics provides the patient with fair, equal health care despite age, race, religion, sexual orientation, or economic status. The fourth principle is non-maleficence. This principle means that the nurse will do no harm to the patient. This allows the nurse to always provide the safest quality care. This includes situations such as holding a blood pressure medication when a reading is outside of parameters. One concern for ethical issues is the way in which coordination of care may be affected. Issues that may halt the continuation of care would affect the patient's personal or religious beliefs. Excuse me. The nurse may encounter patients who choose not to treat certain diseases due to religious beliefs. This may be hard for nurses and the rest of the interdisciplinary team to agree when the condition is able to be managed. Nurses must step back and allow the patient to use their right of autonomy. This affects the coordination of care, but also allows the patient to remain autonomous. The final portion of this presentation is an overview of social determinants from the Healthy People 2030 website. According to an article from Healthy People 2030, social determinants of health are conditions in the environment where people are born, live, learn, work, play, worship, and age that affect a wide range of health, functioning, and quality of life outcomes and risks. The 5 categories of social determinants include economic stability, access to quality healthcare, access to and quality of education, neighborhood and built environment, and social and community context. The goal of Healthy People 2030, when it comes to social determinants of health, is to promote physical, social, and economic environments that foster well-being and attain the full potential of health for all individuals. With the help of the interdisciplinary team and organizations such as the American Nurses Association, patients will be able to receive highest quality of care. Good care coordination greatly improves lives of individuals living within long-term care facilities. Care coordination is a pivotal part of patient care that ensures all bases are covered and the patient receives the best quality care. As the care coordinator here at Community Care Center, I want to thank you for meeting with me today. I appreciate your organization's work towards the nursing profession. This concludes my presentation, and I thank you for your time.